Good evening. I'm Dr. Deborah Eduardo, Superintendent of Schools for LA County, and I am so pleased that so many of you have joined us tonight for this parent town hall. We're going to be discussing COVID-19 and schools, and we're really pleased to be here with Dr. Ferrer from the Department of Public Health, and we're going to start off by doing introductions of the other panelists. So as I mentioned, I'm Deborah Eduardo, Superintendent of Schools for the LA County Office of Education. We also have Dr. Dawn Terashita. She's the Associate Director for Acute Communicable Disease Control Program at the Department of Public Health. We're also very fortunate to have Dr. Barbara Ferrer, the Director from the Department of Public Health, and hopefully we're having some technical difficulty. We have a moderator who is my deputy, Mr. Arturo Valdez, who's trying to join us, but you know, the show must go on, so we're going to move forward until he's able to join. In an effort to answer some of the most common questions, we're going to start with a discussion between the three of us, and then we'll move on to additional questions that have been sent in earlier for the chat. We know you have lots of questions, and we're going to do our very best to make sure that you get your questions answered. Public Health will also post answers to the most common questions we weren't able to get to on their website next week at publichealth.lacounty.gov. As a reminder, you can submit questions during the town hall in the chat box, and we'll get to them as soon as we can. And if you would like to listen in Spanish, you can call 888-664-1453 on your cell phone to listen to the translation. Again, that is 888-664-1453 si quieren escuchar en español. So let's go ahead and get started. I'm going to address the very first question to Dr. Ferrer. Dr. Ferrer, quite a few folks asked if you can talk a little bit about where our community is with the virus. Are we seeing an increase? What is the cause of any increases? And are we seeing greater increases in certain communities?
Yeah, thank you so much, Dr. Eduardo, and in particular for partnering with us for these many months, trying to make sure that we can support the work of the LA County Office of Education in offering educational opportunities for all of the students. And I also want to welcome bienvenidos a todos to all of the parents that are joining us tonight. We know the work that you're doing and the support that you're giving your children is essential, but very difficult during these challenging times that we're all facing together. But I want you to know we appreciate you took some time to jump on the call with us tonight. We hope we're able to answer as many questions as possible, and please know that we are here to support you as parents. And as we talk tonight, we also want to acknowledge, straight from the onset that everybody, depending on what experiences you have had during this pandemic, may have a different perspective and may have a different set of questions and concerns. And please note, it's never our intention to make decisions for parents. You know best what's appropriate for your children. We're here to really support you and make sure you have good information as you make decisions about your child and about your family during the pandemic. But I do want to start by just saying, it's unfortunate that at the moment we're actually seeing a lot of increase in community transmission here in LA County. I say it's unfortunate because a month ago we were doing really well. And then we started seeing a pretty significant increase in cases, so much so that we had 4 days last week where every single day we were reporting over 2,000 new cases just for that day alone. So many of you have been tracking this for a while. You know that we have really thousands and thousands of cases that have happened across the county. And you also know that we have cases for people of all ages. To date, there are 32,000 cases in the county that have occurred amongst children under the age of 18. And I know that's sobering because for a long time, people were under the impression that children weren't able to get sick or have symptoms or be infected with COVID-19. The reality is everybody can get infected with COVID-19, including our very youngest children and our very oldest residents. And it's our job to make sure that in everything we do, we really need to think about how we're protecting each other, because those are the tools that we have with us as we go through this pandemic. Today, our test positivity rate, which means of everyone who gets tested every day, and we have somewhere between 30 and 40,000 people that get tested here in the county every day, about 5% of the people who are tested end up with a positive test result. We have an increasing number of people in our hospitals. We had weeks of being under 800 patients a day in the hospital, where today we were at 855 patients. Unfortunately, whenever we see an increase in cases, a few weeks later, we start seeing an increase in hospitalizations. And I know the big question on everyone's mind is, well, if we have so many cases, how are we going to possibly think about what we need to do to get our children back to school? And what I want to say about these cases is we learned, and especially after that huge surge in July, where we were having over 3,000 cases a day, that every single one of us has steps we can take that actually lower the rate of transmission. We went from 3,000 cases a day to under 900 cases a day. So we know what we need to do to actually protect each other. And it's fairly straightforward at this point. Everyone needs to wear a face covering whenever they're around people that aren't in their household. Everyone needs to keep their distance, at least 6 feet, when they're not around people that are in their household. Everyone needs to wash their hands or use hand sanitizer more frequently than you ever have before, because we know that helps prevent transmission. And in all of our schools and all of our businesses, the way we reopen here in LA County is we issue health officer orders. These are directives that say, when this business opens or this school opens, here's the list of requirements that people will need to do in order for them to have as much safety as possible in that environment. So whether you're going to a grocery store, or you're going to work in an office, or you're going to work at a manufacturing plant, every single one of those sectors has a set of directives. These are requirements of what they need to do at that place so that we can create as much safety as possible. I'm going to turn it back to you now, Dr. Eduardo.
Thank you, Dr. Ferrer. And it really does sound like it's going to require all of us coming together and making sure that we're doing everything possible to reduce the spread by following public health orders so that we can get as many kids back to school as quickly and as safely as possible. So thank you. The next question is for Dr. Terashita. Can you talk a little bit about the virus itself? How is it spread? And is it similar to the flu? And we received a lot of questions about the virus and whether or not children can get it or even transmit it. And I know Dr. Ferrer touched on that. Can you clear up the confusion for our parents out there?
Hi, thank you. Yes. You probably have heard a lot about coronavirus at this point. Coronavirus is a respiratory virus. It's been floating around in the human population for many decades now. Occasionally, it has caused some large outbreaks. You may remember diseases such as SARS or MERS throughout the past few decades. And it has caused a new disease right now, which we call COVID-19. Generally, the symptoms of COVID-19 are respiratory, so it includes symptoms such as fever, cough, shortness of breath, For children, I know we're talking a lot about children. It could include symptoms such as gastrointestinal or stomach type symptoms like nausea or vomiting. It can cause lots of different symptoms in lots of different people. In that way, it is similar to flu, which is also a respiratory virus, but in many ways it's different from the flu. We have no current treatment to treat it. There are some treatments to modulate the disease, but there's no specific treatment for coronavirus. We also don't have a current vaccine, although there's a lot of news about that every day, unlike the flu. One of the common questions we get is, does it occur in children? I heard it doesn't really occur in children. And that's completely untrue. In LA County alone, we've had over 30,000 cases of coronavirus in children. Many of these infections have been severe. Luckily, we have not had any deaths at this point, so the mortality is quite low, very fortunate. But it does mean that kids can get infected, and when kids can get infected, they can infect others. And we have many, many outbreak scenarios, many transmission scenarios where we have seen children affect and infect others.
Thank you so much, Dr. Terashita. And the next question is actually to me. And the question here is, what has LACO, the LA County Office of Education, done to communicate with families, and what has our message been throughout this year to support families? And, you know, I just want to reiterate what Dr. Ferrer said, that we realize that this pandemic is extremely difficult on everyone, and that everyone is doing the best that they can to get through it and to move forward to the extent possible. I can tell you that I have a grandchild that is with me on Tuesdays. His mother is a teacher, and my husband and I, who are both educators, are working with him on Tuesdays and seeing how hard it is for him to engage in his instruction from a distance. So I just want to say that I know how difficult it is, and especially if you're talking about a child who is an English language learner or is a student with a disability, it can even be more difficult. But what LACO is doing to support districts is we're making sure that we're providing resources to our districts that they can then share with their students and their families. So we are constantly surveying our 80 superintendents and asking them, what are they hearing? What are the family needs? What are the school needs? And coming up with a plan to support them. Regardless of what that is, it may be that they need a computer or they need technology. It may be that they need additional food, whatever it is that we're hearing, we're asking and looking for support, as well as PPE for schools and for families, so that people we're sure that people have what they need. We also know that this pandemic is affecting people differently, depending on whether or not you have a pre-existing condition, depending on whether or not you're an essential worker and you have to go out into the field. We know in our lower income communities, there are more family members that don't have the luxury of working from home. So we're doing a lot to try to support our families. We've entered into very strong partnerships, one with the Department of Public Health, and we're so fortunate. We have Dr. Ferrer, who joins our weekly calls with our 80 superintendents and updates them and helps them to plan for reopening and ensuring that they're following all of the health orders. We also are working very closely with the Department of Public Health as they go out and actually do school site visits. So they're not just taking schools' words on this, they're actually visiting the schools, walking through the campuses, making sure that they have everything in place to ensure the safety of children and employees when they return. And doing things like this. Having an opportunity to engage with principals and parents and other stakeholders to provide updates. And really, it's so important that we're just communicating consistently and making sure that people have accurate information. In addition to the partnership with the Department of Public Health, we're also working very closely with other county departments. The Department of Mental Health has done an amazing job of providing resources to students and teachers and families about making sure that they're emotionally doing okay through this pandemic, and providing resources as far as hotlines and other places where families can get assistance if they need counseling, as well as working with the Department of Children and Family Services and parks and libraries and nonprofit organizations. This is really the time where we're saying we all need to come together and we need to leverage the resources that we have so that we can ensure that our children, our families, and communities have the resources that are available to them. So a lot of work is going into making sure that we're also focusing on reopening and doing that in a way that's gradual, that's safe, and that really focuses on being very transparent so that all of our employees, our parents, our students feel that they have a voice and they can contribute to the conversations and the decisions that are being made about how and when we're able to reopen schools. So that's where we're at in terms of some of the supports that we're providing. The next question that is on the list here that came in from parents is for, let's see, this one is for, do I have the right one? This one is for Dr. Terashita. We received this question quite a bit from parents who are sending their children back to school or preparing to send their children. They want to know what they can do to protect their children from the virus.
Thank you, Dr. Eduardo. This is a very important question. It is what we are here for. Public health is here to protect you and your children, and so it's a question we take quite seriously. There's a lot of things we can do with COVID. We've been watching the research, we've been seeing the studies. There's a lot of things we can do to protect everyone. The most important thing is social distancing. You've probably heard this. That means trying to stay away from others whenever possible, staying away when you're sick. If you must be out in public, make sure you stay at least 6 feet away from others. And then that leads to the next point, which is really wearing a face covering, some sort of cloth face covering or mask. This is really to protect others, but the latest science has shown it can also protect you. This makes a lot of scientific sense. The main mode of transmission of the COVID virus is through respiratory droplets. So when someone coughs or sneezes or speaks really loudly, they can transfer the virus in their respiratory droplets and someone else will breathe them in, and that's how they get infected. There's many other things you can do, such as encouraging you and your children to wash your hands. We encourage using soap and water for at least 20 seconds. You should do this before and after you go to the bathroom, before and after you eat, before and after blowing your nose or coughing, or anytime you touch your face. Really, we want people to wash their hands often. If soap and water are not available, we recommend using a hand sanitizer with at least 60% alcohol, and always wash your hands with soap and water if your hands are visibly dirty. Another thing you can do is really keep your environment clean. You should clean and disinfect frequently touched objects, such as toys, such as doorknobs, and make sure you're using a cleaner that is effective against the coronavirus, which you can find on the label. You want to make sure where you're going has good ventilation. One of the best things to do is, if you're going to be around others, is to stay outside. You've probably heard this. We've encouraged a lot of these school type activities to occur outside because outside is safer than inside. We've been working with the schools to make sure these messages are very clear.
Thank you so much. And I want to remind our listeners that if you have a question, please feel free to submit your questions into the chat. Dr. Ferrer, we know that schools can open for specialized services and that schools with approved waivers can open for grades TK through 2. But how many schools have opened up so far and how many students have returned?
Yeah, this is a great question, and I also want to, thank all the parents, because when some of you have already sent your children back to school, we do allow all schools in the county can reopen for what we call services for high need students, and each school can define high need any way they want. And they can send, at any given time, they can have about 25% of their total student body back at school for these services. The services have to be delivered in what we call a cohort. That means a stable group that stays together for the entire time they're in the school. And it's a stable group with stable adults. So same adults, same children. That's one way that we try to prevent there from being a lot of transmission across many different groups. Right now we have over 1,500 schools that either have reopened already or are reopening for services for high need students. And that means there's about 75,000 students that are already back in their school buildings for special services. And the special services can include a classroom service, they can include some one-on-one therapies for some students who needed them, they include coming back for assessments. And there's about 31,000 staff that are back as well, providing these services. We also have another program that Dr. Eduardo mentioned that we're allowed to do while we're in Tier 1, this tier that we're put in by the state because we have a lot of community transmission too, and that's called the Waiver program. And right now we've got any school can apply for a waiver to bring back students in classes TK through grade 2, but it's an application process. So you do have to apply to us, you have to submit your forms, you have to be able to show us that you're going to be able to bring students back safely and that you've consulted with parents and with teachers and with staff about how to create a safe environment. And here we have 74 schools that have already been approved. There are 233 schools that have applied. We have about 60 schools that are in the pipeline to get approved, and the remaining ones are just missing some documentation. We can approve 50 schools a week, and to date we have about 8,000 students that are back getting services because they're in getting instruction because they're in classes TK through grade 2, and about 1,600 staff have come back to provide those that classroom instruction. And again, these are the two programs we're allowed to do because we're in Tier 1. The state is sort of sets the boundaries for us and gives us our options. In order for us to offer more options for everyone, like everyone asks me this question all the time, when can everyone who wants to, and I want to say it's really who wants to, when can everyone who wants to be able to send their children back to school? That cannot happen right now under the existing rules until we get into Tier 2. And to get into Tier 2, we have to have less transmission of COVID-19. We have to have less cases each day here in the county. And we have a little ways to go there. So for all of you who want to see us get to the place where schools can reopen for general education, we need your help getting ourselves back to the place where we're slowing the spread. We have to get down to about 700 cases or so per day in order to be able to get into Tier 2. So we're averaging way more than that right now. I think in the interim, you should work with your schools about whether or not there's opportunities either to come back, have your child go back because they need some special services, or talk to your school about whether or not they're applying for a waiver application. But I want to emphasize that every parent has to make their own decision. Just because we've set forth a set of directives that schools can use so that they can reopen with safety doesn't mean we're saying that every kid or every child needs to go back to school. That decision rests with parents and families. In the meantime, If your decision is that you don't want your child back at school, that is an appropriate decision. No one should question that decision, and you will have access to ongoing virtual learning opportunities and support for that virtual learning. That's the deal while we're in a pandemic. We are not going to make children go back to school because everybody has unique circumstances in their family, and you need to decide for yourselves what kind of risk you're willing to accept. And no matter what, from the moment you leave your house during a pandemic, there's other risks, and we can do everything we can in our schools. And as Dr. Eduardo mentioned, we inspect every school that's reopened. So there are pages of directives about what schools need to do to create that level of safety, but we actually go to the school and we walk through the school with the administrators and we check that they're actually able to do all of the things that create as much safety as possible. But I'm going to put it back also and say we each have our part to play. Your children need to come to school prepared to wear their face coverings. They need to follow the rules about not gathering with children that aren't in their cohort. And you need to help explain that when they get to school, it's going to look a little different. The desks are going to be as far apart as possible. They're going to be asked to not touch other children's things or stuff and not share things. So some of what we're all really used to, and in fact, some of what makes a school exciting places, we just can't do during a pandemic. But these are part of the directives that schools have put in place to create as much safety as possible.
Thank you, Dr. Ferrer. And could you clarify how you're deciding which schools will receive a waiver?
Every school that completes their application gets put in the queue for having their waiver approved. So it really is, you have to turn in the right documents. You have to show us that you're able to meet the requirements to open the school safely. And then we have a formula that allows us to look at schools based on which supervisorial district they're in, and then rank those schools based on the need for students who are in lower resourced communities. So we actually look at the eligibility for students in every school building for free and reduced meals. And we use that to give a higher ranking to schools that have a higher percentage of students that are eligible for free and reduced meals. But our goal really is for all the schools that apply for the waiver, if they're able to adhere to the conditions that we've put forth about opening your school safely, we hope over time that all those schools will be allowed to reopen. This week we've extended the number of applications we can accept every week from 30 to 50. So we think that will help us get more schools in. And as I said, we only have 233 applications in to date.
Thank you, Dr. Ferrer. And I just want to add that we're working closely with Dr. Ferrer and her team, visiting school sites. I was at Mann Elementary School today in the Glendale Unified School District, visiting classrooms, walking through the entire campus. They've been doing an excellent job. They've brought their students with high needs back. All of the children were wearing masks. There was good signage. They are ensuring that children are being monitored for symptoms. Great instruction is taking place. And again, you know, just as Dr. Ferrer said, some parents are going to decide to send their children to school physically, and some are going to choose to continue with distance learning. And all of our districts are prepared to offer all of the options so that no family should feel they're being forced into any specific decision. It really is up to your unique circumstances. So I just wanted to say that I also was on a meeting today with principals from districts outside of LA County. So we had thousands of people participating in that. Those of us from Los Angeles learning from some of our counties that have already reopened schools because they're in the lower tiers, and learning from them. And really everybody is saying that children are very capable of following the directions, of maintaining the physical distances, of keeping their masks on. And there's been very little issues in terms of the districts and the counties nearby that have opened up their schools. So I'm going to turn the next question over to Dr. Ferrer. And you did mention this already a little bit, Dr. Ferrer, but what can parents and their children expect when they return to school? What's going to be different? And I know you've already kind of touched upon that.
Yeah, I mean, I think, you know, it's such a good opportunity for parents to actually be talking with the administrators at the school and the teachers at the school before they come. I know I was talking with a principal today who told me they made a video for their parents so that before their parents even came, they could see all of the safety measures that were in place, and so they could talk to their children also about what to expect. Because I think that's really important, is that children have an opportunity to understand not only that there are going to be changes, but why those changes are happening. I think from the very first moment that you come in, all schools are going to be doing symptom checks, because it's super important that no children with any symptoms of illness, any symptoms, runny noses, come into the school building right now. Because unfortunately, many of those symptoms are actually the same symptoms of COVID-19, and we wouldn't want to have any unnecessary exposure. So if your children are sick, even mildly sick, they really need to stay home. But they're going to get checked as they come in, but that also means we can't have any crowding when you come to your school. So before, at arrival time and maybe at dismissal time, there were hundreds of children and hundreds of parents that may have been milling around. That can't happen anymore. We can't really have that kind of crowding. So your child needs to expect that there'll be an orderly transmission into the school building. You know, this transition will mean that everyone is always staying 6 feet apart as they come in, and children will be directed to go to their classroom. And really, that classroom is their home for the day. Whether they may be going outside for part of the day, but they're going to stay with that group of students for the day and for whatever portion of the day that they're there. And the classroom's going to look different because, as I said, we have to do that spacing. You know, children are going to need to keep their distance from teachers. Everyone's going to be wearing a face covering. Many teachers may also, particularly for the younger grades, have a face shield over their face covering for some added protection. But I think if children are very good about understanding what they need to do if we give them time and we explain to them why. I think it's very hard to just order people to do things, even adults. We all do a lot better if somebody explains to us why it's so important. And I think that's one thing we'd like parents to help us with. You know, please help make sure your child understands why it's so important to keep their distance and to follow the rules. This is the way we keep that environment at school as safe as possible and prevent as much as possible having a lot of transmission of the virus in the school building.
Thank you, Dr. Ferrer. And the next question actually was for me. It was, how are teachers being informed about the protocols and how can they protect their students? So teachers are being informed. Every school is required to have a reopening plan. They're required to share that plan with their teachers and actually all of their employees. In addition to that, LACO is having level-alike meetings to support all of the employees. So for example, we have meetings just with school nurses to help school nurses be prepared and know exactly what their role is, as well as school counselors and principals, labor leaders, and our chief business officers. We're providing resources and tools for district leaders so they can take to their teachers and continue to reinforce the need to communicate with all of the stakeholders and ensure that we have a transparent process. And I have to say that, what we've heard from Dr. Ferrer and her team is that our school leaders and districts have been the ones following the rules the most and have been very compliant in terms of making sure that we're doing everything that is being asked of us to ensure the safety of everyone, our employees and our students as well. So the next question is for Dr. Terashita. We also received questions about what happens if there is a case or an outbreak at a school? What happens and how will parents be notified, if at all?
Thanks. That's a great question. I mean, I think we all know we are in the midst of a pandemic and we have widespread community transmission here in Los Angeles County and throughout the country. So it's very reasonable to assume that when schools open, schools will have a case of COVID-19, either in a student or a staff member. So I'm actually very proud of our team. We have a crackpot team here that has many guidance documents for schools for this very issue. What to do when you have a case, what to do when you have 2 cases, what to do when you have 3 cases, and they're all on our website. We also have very amazing partners who we've been working with on an ongoing basis. The schools participate in regular telebriefings, and they've been participating in focus groups. We've met with leaders, we've met with Waiver. I think Dr. Eduardo was covering a lot of this. We've been working very closely to make sure everyone understands these documents, which change and are updated constantly. Basically, when you have a case at the school has formed a task force or team, a COVID team that is there to take care of this. The first thing they do is they get notified of the case. They make sure that case is isolated or sent home, staying at home, right? They make sure that this case is interviewed. All the contacts are identified. A close contact is someone who has been within 6 feet for 15 minutes or more in a 24-hour period. They have identified if the current cohort that this case is a part of has been exposed. In other words, was this case exposing the cohort either after symptom onset or 2 days prior to symptom onset? If that is the case, the school is quickly notifying all the contacts to, of course, stay home and quarantine. At the same time, LA County is calling the case and the contacts, and we're doing interviews and making sure people are staying home appropriately. If we have 2 cases, we do the same thing for each case, but I also try to look for links between the 2 cases. We call these epi links. We try to see if 2 cases shared the same cohort, shared the same bathroom, shared the same food, shared the same whatever. If we find a link, we're able to try to find more cases. If we identify 3 or more cases, we declare this an outbreak, and we have a whole separate outbreak protocol, which again is continually discussed with the school, and guidance documents are available on our website.
Thank you so much. I want to move on and quickly get through some of the other questions we've received ahead of time from our parents in the chat. And a very popular question is, how should we look at smaller districts that have really good COVID data, meaning they have low cases, low deaths, and help move them to reopening? Is it possible to open schools at a zip code level instead of county-wide? Dr. Ferrer.
Yeah, thanks so much. I know this is a really important issue, so I'm going to first answer it, just with what are the restrictions that we face like every other county in terms of the fact that we're all under the state health officer orders. So the state has divided the counties, placed the counties in tiers depending on community transmission, and we are in tier 1, which means we have the most community transmission. If you're in tier 1, your options for reopening wherever you are in the county, even if you're in a part of the county that may have a lower case rate, your options for reopening depend on the entire county moving from tier 1 to tier 2. So our options are county-wide options. The state does not have us dividing up areas either by zip codes or cities or towns, although I know lots of people would like us to do that. One of the reasons why the state's not doing that, and one of the reasons why it becomes problematic, is, as many of you know, the people in your school community do not necessarily all live in the neighborhood. Many of them may be traveling, many of your staff and your teachers may be traveling from other communities. And even for many of you, you're drawing from students from lots of other communities. So the idea that if in one neighborhood the rates happen to be lower, that should be the reason why that school would get treated differently falls apart a little bit for most of us, because in most of our school communities, we don't have people that all live in the same neighborhood. There are, of course, exceptions, and those are usually with much smaller schools. But the state, and I think appropriately, has really urged us all to understand that we very much depend on each other as a county for the safety. And that transmission, even if in some communities it seems lower than in other communities, there is still a lot of intermingling that's happening at places like our schools that makes it hard to just look at the rates for one community versus another. I will say that I think it's equally important, however, for school districts to look at data for their district. And the reason I say that is you want to really understand not just the relationship of your school district to another school district. I think just as important, are you seeing increases in your school district? Right now, pretty much across the board, almost every community in LA County is seeing increases in the case rate. And that should be a reminder to all of us that we have to get back to doing what's right and slowing the spread. Just because your rate in one community is lower now than it might be in a community, like West Side versus East Side or North versus South, for most of us, just about every community is seeing an increase in cases right now. And that should be a note for all of us to take caution and really get back to trying to protect each other.
Thank you. And that's definitely a concern as we're headed into the holiday season. Another question that came in from the chat is, why are waivers being offered for TK and second grade and not TK through 6 as allowed by the state? And also, why is there a limit on the number of waivers being granted?
Yeah, I think those are both great questions and important for us to try to answer. So in Tier 1, where we are now, we are allowed to offer waivers that would allow schools to bring back their students in grades TK through grade 6. That is an option that's available. In our county, we decided to, as Dr. Eduardo mentioned, I think at the beginning, to be cautious and go slowly, and first reopen our schools for students in grades TK through grades 2. We needed to make sure that we could do this right and not actually increase community transmission, increase the number of people that have cases, because everybody in that school building lives in a community and lives with other members of their household. And whatever happens in the school goes back out to the community and back out to the household, and vice versa. Whatever you're doing in the community, whatever activities you're participating in or not participating in, you bring those risks into the school building. But we wanted to make sure we could do this well. And I'm really pleased to say, I mean, we've opened, as you can see, 1,500 schools and 74 schools under the waiver program. And so far, while we do have cases at schools, we don't have any large outbreaks. As a matter of fact, we only have, out of all those schools that are open, we only have 10 schools that have seen somewhere either 3 or 4 cases. Only one school has seen 9 cases. And I'm going to unfortunately use that school as an example, because what happened there was students who were on a baseball team went to Arizona to play a baseball game. And a lot of them got infected in Arizona and came back and infected other people. And now those are students at a school. So unfortunately, this is what happens. This was not a school activity. This was an out of school activity. But those same students were going to school. So it affects the school community, which is what I mean by we all have to be careful and understand that if we want our schools to stay open, we have to be careful about what we're doing outside of our schools. But that's the reason for going slow. We do anticipate that it's highly likely, once we have really good data that shows we're doing this with a lot of safety, we would be able to expand that program. both to allow a higher number of waivers to be accepted and also to allow more grades to be included.
Thank you, Dr. Ferrer. And as you're drinking your water, I'm going to have a follow-up question for you. What is the threshold of confirmed cases that the school must have to close again? So you talked about there have been some incidences. How many cases would cause the school to have to close?
Yeah, I'm going to actually ask Dr. Terashita to chime in on this because, again, the state sets the thresholds. And if you have a certain number of cases at a school, the school will need to close. And if you have a certain percent of your schools that are closed, the entire district may need to close. But Dr. Terashita, do you want to give us the latest numbers on that? Or did you want me to?
Well, maybe I can start.
Okay.
Yeah, this is actually quite a difficult question because each outbreak is so different. I mean, everyone on this call knows that schools are very different, different sizes, different areas, different student bodies, different ages, right? And then we also have a difference in whether staff are sick or whether kids are sick. So the answer is it depends, but there's a lot of guidance, again, from the state, which we follow. So individual school closure is recommended based on the number of cases, the percentage of the teacher, student, staff that are positive for COVID-19, and often need to be done or considered in consultation with local public health. Because it is very complicated. But the state recommendation, or they give an example, that individual school closure may be appropriate when there are multiple cases in multiple cohorts at the school, or when at least 5% of the total number of teachers, staff, or students are cases within a 14-day period. And again, it depends because each of your facilities is so different. There may be other circumstances that may warrant school closure. Maybe, for example, that infection control or cleaning and disinfection was extremely difficult for some reason. Maybe there's just ongoing cases and we can't get a handle of what is happening at the school. There's a number of reasons we may close the school, but again, it really depends.
And then I think a superintendent would be asked to close the entire school district if 25% or more of the schools in the district have been closed due to COVID-19 within 14 days. And, you know, that 14-day period is because that's the incubation period for the virus. So if I got exposed today, it could take 14 days before I become infected. And I know that, you know, I have a test and the test shows that I'm infected. So you do have to wait the full 14 days, but we look at the time periods based on understanding that, you know, a case today in one student, we have to wait 14 days and watch all of the people that were exposed to understand how many of them might end up being positive for COVID-19. And we will recommend, you know, if you are a close contact of someone who's positive or your child is in a school setting, we will be recommending testing, but you'd still have to stay home the entire 14 days for the quarantine. Because if I test negative on day 3 of the quarantine, I still can become infected at any point between day 3 and day 14. It helps us know for sure that you're not infected right then and there, because if you are, then we have to look at all of your close contacts, but it doesn't mean that you don't have to quarantine for the 14 days.
Thank you. So the next question is, what has been explored in terms of offering outdoor schooling? And I can say in terms of our school districts, our leaders are looking at every bit of space that they have. They're looking at their classrooms, they're looking at their outdoor areas. We know to the extent possible, it's better to be outdoors than indoors. And so districts are looking at the spaces that they have and creating spaces that can be used outdoors. You know, each school site is different. Some have more space and more ability to provide more instruction outdoors. The meeting I was in today with some of the districts that have already opened outside of LA County, they've had using both. So they have the students in their classrooms, but they're making sure at least every hour they're getting out and getting fresh air. So I don't know if Dr. Ferrer or Dr. Tashida, if you have anything that you'd like to add in terms of outdoor versus indoor.
Sure. I mean, we love the idea of putting as many activities outdoor as possible. The one activity that we highly recommend always happen outdoors is any eating. You know, so anybody in a breakfast program, a lunch program, a snack program, everybody should be outdoors as much as possible when they're eating. And the reason for that is you have to take your face covering off to eat. And every time you take your face covering off, there's greater risk of transmission. So for eating, students will stay with their groups, but they should be outdoors, and they should, of course, be 6 feet apart for those eating, you know, whenever they're going to be eating, even snacks. But there are some schools that have asked us if they could just reopen the entire school if they did everything outside. You know, so if they offered all of the instruction outdoors, could we allow them to open? And it has a lot of appeal for us, and we think it's wonderful that schools are really trying their very best to set up situations where they can keep students outdoors as much as possible. We do need a waiver from the state while we're in Tier 1 to be able to do that, because obviously we don't have opportunities to bring back entire schools yet and all of their students. But I think one way parents can help is, again, encouraging, getting in touch with your schools, finding out how they're exploring outdoor options, and also explaining to your children why they're being asked to do some activities outdoors. And it is just because outdoors there's a lot more air circulation, and that means that it's harder for the virus to infect other people should the virus, you know, be present in the air. It kind of will dissipate more if you're outdoors. So we love the idea, and I want to thank all of the educators who have been really looking hard at what they can do to encourage a lot of activity outdoors. I also want to mention there are some things that can only happen outdoors at schools right now, and one of those is all youth sports. So there's no youth sports right now that are allowed indoors, but outdoors many teams can get together. They can do conditioning, they can do skill building, they can do any kinds of activities that don't require close contact, where they can keep their face coverings on, but it all has to be outside. And they have to stay in stable groups and do that outside. So many schools have also done a great job on that, moving all of those activities outside and letting students come back to the campus to do these, you know, youth sports activities. And youth sports is very broadly defined. So you know, you can have lots of teams of students that are coming back to do conditioning and skill building. It didn't mean that it was your elite players or the kids that were, you know, traveling, or these can be just groups of students that are getting together to build their skills and do some conditioning. And that is permitted right now at all school campuses.
Thank you, Dr. Ferrer. And, you know, the next thing I'd like to ask from the chat is, you know, what are we doing for our students with special needs? How can we protect them, especially students that are immune compromised and maybe those who simply can't wear a mask? What are we doing in those circumstances?
So this is where, again, a good partnership with the schools is so important. So for students who cannot wear a mask because they're medically not able to, and they have an IEP that actually states that they have an individualized education plan that actually says they're unable to wear a mask. There's two alternatives. The first is if they can put a face shield on with a drop cloth, that's a good substitute for a mask, and that's allowed. So that actually is a face shield. You've seen those, I'm sure, on TV, but it has to have this drop cloth so that respiratory droplets don't leak out. So for students who can wear that instead, that's a good alternative. For other students who cannot wear a face covering at all, they will need to be, if they're going to be back on campus, in a one-to-one situation with a staff person or a teacher. The teacher or the staff person would be wearing additional protection We have additional masks that teachers can wear that protect them from people who are not wearing masks. And in some cases, if there's going to be close physical contact, they may need gowns and gloves as well. But what we can't have is students without a mask in a room with other students. Some parents have said to me, well, what about you have a classroom with a lot of students, none of them wear their masks? And that's also not allowed. We're not going to create risk for other students who aren't wearing masks. So for students who cannot wear a mask, it's a medical condition that's been included in an individualized educational plan. They will work with their school to either do one-on-one instruction, or for many of them, and for many parents, you may decide that the safest route for you is going to be to have your child remain at home and get services at home. But as you know, for those of you who have children with IEPs, many of them are already back in the schools. Many of them are wearing face coverings, and those that aren't are being offered one-to-one instructional support or supportive services. Many of our medical therapists, I know because we have a lot of staff here who are, who provide therapy for students in schools. Many of them are now back on campuses doing individualized therapy for students. But that's something to negotiate with your school about what would work best for your student.
Thank you, Dr. Ferrer. And I just wanted to add that there are, just as you said, there are many schools who have brought back their students with disabilities and are providing the support that they need. And our teachers are wearing, higher level protection to ensure that they're safe as well. So I wanted to thank you for that. It looks like we've answered all of the questions that I have from.
I think Brett is going to feed us all of the additional questions coming.
Yes, I am. Thank you, Dr. Eduardo, for filling in as well, too, moderator. So we do have plenty of additional questions coming in through the chat. I'm just going to try to get through as many as possible. One that we got is particularly popular as well as, what do I do to qualify to keep my child home and safe until infection rates go down until it is safe to return? Asking if they can opt out of sending their children back.
Yeah, absolutely. As it has been mentioned already, that parents will have options. And if there is a parent that does not feel comfortable sending their child back to school, schools will be offering some form of continued distance learning. So there isn't anything that a parent needs to do other than as schools will open, they'll be surveying their parents to ask what their choice is, and they'll be very respectful of the choice that parents are making.
Thank you, Dr. Eduardo. And another question here, Dr. Terashita may want to address this. What is MIS-C and is it COVID related?
Hi, Brett. Thank you very much. MIS-C, it stands for Multisystem Inflammatory Syndrome in Children. It is related to COVID. You may have seen news about this or some literature on this. It's a post-viral syndrome that has been documented in children and including some adults more recently, where it's kind of like a lingering infection or an inflammatory response. So usually it affects some of the other organs in the body, such as the heart, such as the vascular system, and it often is very severe, requiring hospitalization or like ICU care or even death. And we've had a number of cases, a small number of cases in Los Angeles County. We're over 40 cases at this point with no deaths. There have been cases reported worldwide. There's been many cases reported on the East Coast. It's a situation we monitor very, very closely, and we work very closely with our hospital partners.
And this is children who are diagnosed with MIS-C, these are children who either at some point in the past had COVID-19 and we know that they had COVID-19, or when their tests are run, they have antibodies to COVID-19, meaning at some point their bodies saw COVID-19. So that's why people are often asking us, how does this relate to COVID-19? Because it's really something that happens after somebody has had COVID-19. And for some children, they may have had a very mild case of COVID-19. Parents may not even have realized that they had COVID-19, but when blood tests are run, it's determined that they had antibodies to this virus. But yes, obviously, this is of a lot of concern to many parents, although it's a relatively rare disease or syndrome that we see here in LA County, but also in other parts of the country.
Thank you, Dr. Tereshita and Dr. Ferrer. Another question here for Dr. Eduardo. It seems as though it's from an educator. If a teacher or a family member is high risk, will there be alternative work options available for teachers?
So each school site and district is coming up with a plan. They're surveying their teachers and their families and parents to try to figure out how they're going to be able to make this work. To the extent possible, they're trying very hard to accommodate employees who have pre-existing conditions or have someone in their household that have pre-existing conditions. And I think, as I mentioned earlier, in the districts that have already reopened, we were really pleased to find out that they were able to meet the needs of pretty much everybody, because there was pretty much a 50-50 split. A lot of parents still chose to have their children continue with distance learning. So they were able to accommodate those teachers that really felt it wasn't safe for them to come back into the classroom. But this is something that each district is deciding on based on the surveys that they're getting back from their employees and their students.
Thank you, Dr. Eduardo. And another question we have, it may have been addressed earlier, but I'm seeing it additionally in the chat. If a student has flu-like symptoms or any other kind of symptoms, can he still attend in-person class?
No. No, we're all saying no. This is a collective no. No, even if your child has a mild cold, please don't send them to school, because what will happen, unfortunately, because we're being so cautious, is if your child goes to school, somehow gets past the screening and has symptoms and is in that classroom with their symptoms, that entire classroom and those teachers have to now go home until we can determine for sure that that student doesn't have COVID-19. This is particularly important for us to understand, because many children have either mild symptoms of COVID-19, and it can represent as a cold. So no, this is not the time to give your child some Tylenol or Advil in the morning and send them off to school so that they'll get through the day. If your child doesn't feel well, please, please, please leave them home. Let them fully recover so that we're not sending a whole classroom home while we figure out whether or not one child who came in with symptoms had COVID-19 or had an alternate diagnosis. We need to know that there was an alternate diagnosis before those children are going to be able, and teachers are going to be able to come back.
And Dr. Ferrer, I might add, our current guidelines for schools say that if a child has flu-like symptoms, goes to their doctor, has a negative COVID test, has a note from the doctor saying this is not COVID, they still need to stay home for 72 hours afebrile and the rest of their symptoms improving. So that's our current recommendation for schools.
Yeah. So that means staying home 72 hours without a fever before you can send that child back, even if it's flu and it's not COVID. And we're really going to ask everyone to do their very best on this. I know it's a hardship, but it's one way to keep our schools open is for us not to have a lot of sick children coming into the building, or sick teachers or sick staff. So for all those staff people that feel compelled to, again, take the Tylenol, come in when they're just feeling under the weather, not during a pandemic, that is not going to be appropriate, and it's going to create a lot of unnecessary risk.
Yeah, and schools are going to be very strict on that. So, you know, as soon as a child walks through the door, if they identify any symptoms, they'll be isolating that student and sending them home.
Great, thank you everyone for clearing that up for anyone who may have joined late. Another question is, what should happen if classroom windows cannot be opened and the district cannot afford to upgrade its ventilation system? Isn't proper ventilation one of the most important safeguards we can take?
I mean, there's a requirement in the health officer order that there has to be sort of a minimum level of ventilation, appropriate ventilation in the building. And I don't think that that's just because of COVID-19. I think buildings have to have adequate ventilation for a whole host of other reasons. So I don't know what this particular building is, but again, I want folks to know that the safety protocols right now call for there to be an adequate, HVAC system. That's what we call it, in that building that actually is able to circulate as much fresh air into the building as possible. And schools that don't have those systems in place would probably not be able to open during the pandemic. You don't have to be able to open the windows, but you do have to have an adequate HVAC system. We have stipulations about what the minimum standard is for that, and it is a system that actually allows for there to be fresh air circulating into the building. But again, we're going to emphasize, particularly if windows don't open, best to do as much as possible outdoors in those situations.
And I can add that, a lot of schools that have older buildings already have purchased portable, other types of devices that can help with the circulation of air, and they've used their care funds dollars to be able to do that. And we'll be looking at that closely.
Thank you, Dr. Ferrer and Dr. Duardo. Another question, Dr. Duardo, you may have touched on already, but I'm seeing as additionally in the chat, is how will LA County deal with increase in anxiety and depression after students have been staying home for quite some time?
That's an excellent question, and it's something that we've already been dealing with, because we know not only children, but adults and our teachers and employees have all been under a lot of excessive stress and worry and anxiety. And so we've had quite a bit of professional development for teachers, even now in the distance learning, to how to identify children for wellness, actually doing wellness checks. We have counselors that have been trained. We have teachers that are already looking at which students had higher levels of absenteeism or not checking in, and coming up with plans to ensure that they're mitigating some of that loss of instruction. I mentioned that we have partnerships with the Department of Mental Health. Dr. John Sharon's been amazing, and his team in providing additional resources and additional tools. This really, as I mentioned before, is a time where we all need to take a close look at our children, our communities, serve with more grace, more compassion, more understanding. When the shutdown first happened, many of our districts, their entire focus was just doing those wellness checks and making sure that our families were safe, that they had enough food in their households, and that they were able to connect with them by getting them the devices, the internet access that they needed. And so we will continue to do that as schools reopen.
Thank you, Dr. Duardo. Question, Dr. Ferrer, you may want to touch on. What is the difference between a face shield and a face mask, and what are the benefits or pros and cons of each?
Sure. So you wear that face mask really, I think, as Dr. Terashita said earlier, that face covering that we're all wearing, it really protects other people from our respiratory droplets. So every time you put that on, you're taking care of other people. It turns out it also offers some protection to the wearer, but the main purpose of a face covering, a cloth face covering, is to protect other people from your respiratory droplets. Oftentimes you'll see, those of you who have gone to restaurants may have noticed that we require at a restaurant anybody who's serving food at the table to also have a face shield on. And the face shield is that sort of that, you often see it's like a plastic covering that comes over your entire face. We always recommend you use a drop cloth as well that you can tuck in, again, to prevent your respiratory droplets from getting out. But it's an extra layer that protects the wearer from other people who may not have a face covering on. And you know why we're doing it in restaurants is because oftentimes the wait people are coming to your table and you're eating, so you don't have your face covering on. And we want them to have an extra layer of protection against people who may be releasing respiratory droplets. So you're gonna put that face shield on because it's gonna help you be protected against somebody else's droplets. Sometimes, and a lot of times in schools, you'll see that folks may use both. You know, they'll have the face covering on, the face cloth covering on, to make sure none of their droplets are going out. And then they'll put a face shield on to make sure that nobody else's droplets are going to hit them. This is particularly important for teachers who are working with very young children or teachers who may be working with children who either cannot wear a face covering or may not reliably keep their face coverings on. So those are the two protections that you're going to see most often, I think, in a school. For those of you who have gone to see a healthcare provider, you may notice they have another layer of protection through either a surgical mask that they're wearing or what we call a fitted N95 mask. And these, again, additional layers of protection, particularly, as you know, when you're dealing with sick people, you have to make sure that you're protecting those that are taking care of us when we're sick from any transfer of infections. And you'll also see them oftentimes with face shields as well, or they're wearing glasses to protect their eyes from any respiratory droplets as well. But Dr. Terashita, I don't know if you wanted to add anything to that as well.
I think you covered it, but I did want to just emphasize the mask or the cloth face covering that is often referred to. That's really designed to go over the nose and mouth. So not just over the mouth, which you see a lot of people like kind of having it hang out under their nose, but it's designed to go over their nose and mouth. And then the face shield really protects the eyes. The mucous membranes of the eyes are an entry point for coronavirus. So in other words, if someone like sneezed or coughed directly into your eyeballs, that is a way you could get infected. So people who are at higher risk may want to consider that.
Great, thank you. And another question, just looking for some clarification on cohorts. Are general education teachers allowed to have 2 cohorts of 16 each, one for the AM and one for the PM?
Yeah, so right now, while we're in Tier 1, the cohort size is 12 students and 2 adults. And you can, if you are a teacher, you can in fact be in 2 separate cohorts. If you're a student right now, you're only allowed to be in 1 cohort. So you need to stay with your stable group the entire time you're going to be on school. But teachers can be with an AM cohort and a PM cohort. And obviously teachers need breaks. So there are oftentimes other staff that may come in or may cover like a lunch period or a recess period so that a teacher can have a break. And that's allowed as well.
Thank you, Dr. Ferrer. Another question is, how often will custodians clean classrooms and carpets to make a clean environment for students?
Well, I can tell you that they're continuously cleaning. They do a deeper level of cleaning after the students go home, or if they're doing an AM and a PM, they do a deeper cleaning in between that. But cleaning is taking place all day long. They're going in, wiping down, especially areas that are touched frequently, doorknobs, counter spaces. Also, teachers in many cases have their students helping out with wiping down their areas. They have their little Lysol wipes, and they have a plastic covering that they're using many cases around their desks. And cleaning is absolutely a focus. We are constantly wiping down and making sure that we are disinfecting to ensure that the health and safety of our students and our employees.
One thing that some parents have asked us is, well, what would I do if I didn't think it was that clean? Like, you know, who do I talk to? And we think the first people you need to talk to are obviously the administrators in the building, and we really suggest that everybody's working together on this. You know, some buildings are very large and it may be hard for everyone to stay on top of it, but if you or your child notices that something isn't being done appropriately, you know, please let the administrators know in your building. I do want to note that if you're feeling really frustrated and like, you know, you're just not being heard or, you know, taken seriously and you're worried or you have concerns, we do have a phone line that everybody is welcome to use where you can report concerns around health officer order violations. This is not just for schools, this is for businesses. So many of you parents, you go to other places. So if you see things that you know are just not right and create risk, I'm going to give you a number and I would urge you to call it to report violations or concerns. It's open, I think, 8 to 5, Monday through Friday. It's 888-700-9995. That's 888-700-9995. And we'll, you know, we're here to be of service. We don't want anyone feeling like, you know, I've tried everything, no one's listening to me. That goes for workers and that goes for parents and that goes for students. I also want to say that we are designing what we call an ambassador program that we're going to work with. This is a voluntary program, so please, nobody has to do this, but it's a voluntary program where parents and students can get trained on what are the protocols at school buildings that need to be followed, and they can help make sure that everybody in that community has the information they need to adhere to the rules. I mean, this really is about new sets of rules, new sets of expectations, and we'd love for parents to become part of this, you know, helping to make sure that there's good understanding of what we all need to do to keep our buildings as safe as possible. I want to say, like, we're all learning, and one of the things, again, I want to emphasize is, you know, this isn't really about like punishing people or blaming people. This is about making sure we have really good information so we can make the right decisions. And that's what the ambassador program is about. You know, making sure that there are lots of eyes in the school building, lots of help for students and teachers and administrators to keep that environment as safe as possible. And for parent ambassadors, it's also an opportunity to make sure that as a parent community, everyone understands this notion of sort of what we call cumulative risk. We can create extraordinarily safe environments or safer environments at schools, but if when everyone leaves that school building, they engage in high-risk behaviors, then we'll just see more cases in the schools. Like, you don't get sick outside of school, and then for many people, because there's so much asymptomatic spread, you take a lot of risks outside of school, and then you go into the school community, you bring that risk into the building. And I say this because a lot of people think when we're reopening schools, that means it's safe to just go back to normal in all of our other activities. If my child can go to school during the day, then when they come home, they can have a play date with a whole bunch of different kids every day of the week. And, you know, we can get together and do a lot of gatherings with our friends and our families and bring people inside our houses. It's exactly the opposite. If we're going to have all of our children in school and there's going to be a lot of mingling at schools, that's unavoidable, or you're going to work and you're going to be around other people at work, then when you're not in those places or spaces that are absolutely essential for well-being, you need to reduce risk by not engaging in a lot of the other activities that aren't as essential. So it's really not like when schools reopen, then everything else is open. Our children can just do all of the activities they were doing before after school, and we're not going to worry, and they can have their friends over and go to sleepovers. That's the kind of that's the kind of activities that are actually going to set us back. And as I pointed out, all it took was one baseball team to go to Arizona to play a game when, you know, we don't allow games here. So they decided to go to Arizona, and we had a lot of infections in a school, and it's really setting us back in that school. So I know how hard it is to ask this of everyone, but if the priority is for children to be in school, then some of the other activities have to be a lesser priority, and we have to not really be doing them.
Thank you, Dr. Ferrer. There's a question here asking if there are any dangers from wearing face coverings or masks every day.
We don't know of any, I mean, the danger would be for them not to be cleaned. So if you wore the same face covering every day without cleaning it in between wearings, that's not a good idea. We suggest for parents of young children, it might be a good idea to always send an extra face covering to school with your child every day. So if their face covering gets soiled, particularly on the outside, it gets soiled, they're able to change that face covering. But Dr. Terashita, do you want to also weigh in on this? Because we have a lot of discussions about this.
Yeah, we've seen a lot of questions about, is it safe for people to wear masks every day? Is it safe for children to wear masks every day? I mean, a lot of this is unknown because we haven't had our children wearing masks for prolonged periods, but we do know that there's a lot of people in a lot of different professions that do wear masks all day, every day, and they're fine, right? So I hear what Dr. Ferrer is saying, and I definitely agree. Like, one of the biggest risks in my mind is that people are wearing masks that are dirty. Like, our recommendations say you should clean your mask every day. You're constantly touching your mask, right? You're constantly putting it down on surfaces and then putting it back up to your face. And if your goal is to keep your mucous membranes, your nose and mouth clean and as sterile as possible, the last thing you want to be doing is putting a dirty mask right up to your nose and your mouth. So I would definitely echo Dr. Ferrer, and our main message with masks is really keep them clean, wash them every day. If they become soiled or wet, change it. Put a new one on.
Yeah, and I think the other part of this, which is why we say, you know, let's get our children to understand that they need to wash their hands a lot, is if their hands are clean and they're touching their mask, it's not quite the same as if their hands are filthy and they're touching their mask. So if they're outside and they're playing, as soon as they're done playing, you want them to wash their hands. And I know many of you have already taught your children to try not to touch their mask a lot, and many children are doing a very good job at that. But hand washing is actually a part of this as well. And, you know, teaching children not to, when they're eating, not to just throw their mask anywhere, to have a safe place where they put their mask so it can stay clean until they're going to put it on again.
Great, thank you. There's a few questions as well about rapid testing, about how effective it is and if the county is looking at implementing rapid testing.
Sure. This is a great question. So rapid testing, for those of you who aren't familiar with it, it really refers to a kind of testing that we call antigen testing. And we call it rapid testing sometimes because what it does is it allows us to get a test result in a fairly short period of time. Most of these tests, these antigen tests, will give us a result in 15 minutes, and you don't usually have to send this result to a lab to get the result. So it's something you can do you know, in your home. Sometimes you could do it in a school building, you could do it at a workplace, and as I said, you'll get your results very quickly. There's two issues with antigen testing right now, or this rapid testing, that we have to pay a lot of attention to. We think it's a very promising technology, but we don't have all the evidence that we need yet about when it's most appropriate to use antigen testing. The kind of testing that mostly is happening right now is what we call molecular or PCR testing, and that's the test many of you are familiar with. It's a swab. It goes off to the lab, you know, swab of your nose or your mucous membranes, your mouth sometimes, and it goes off to a lab, and a lab processes it, and they're getting better about it. So usually 1 to 2 days later, on average, you get a result, but the result comes from the lab. And we have a lot of evidence about how effective and reliable that test is, and so we rely on it really to help us diagnose who's positive and who's negative for COVID-19. But as with all tests, even a PCR test, although it's sort of the gold standard for us, you can have a false positive and you can still have a false negative. It's just there are very small numbers of false positives and false negatives. One of the issues with the antigen test is in early studies indicate that it may give us slightly larger numbers of what we call false negatives. So you're told your test is negative, but you're actually positive. So one thing is we have to figure out how, is that really true? And again, there's lots of new tests that keep coming out, and how big a problem might that be? But the bigger issue for us right now is that it's been tested mostly on people who have symptoms of COVID-19. And so if we want to use it as a test for people who are asymptomatic, we have to do a little bit more research. And we actually here in LA County are one of the sites where we're doing more research. We have a program right now to test, to use antigen testing and PCR testing in our firefighters in LA City and see how closely they give the same results, even if people have no symptoms. And the second phase of that study is to do the same in children. And we have some schools that have signed up that will be soliciting permission from parents so that we could test this in children. But it is true, it will be a game changer if in fact it's a pretty reliable test and you don't need to send it to the lab and you get the results fairly quickly. But we need the evidence to make sure that that's true. And then we need to figure out how you would administer this in a way that actually allowed you to be certain of the results, so that you could use that to help make decisions around for whom it is safe to be in a school environment. I want to say that we've all seen a lot of examples recently of groups of people that were getting tested every single day where there were still positive cases in those groups of people. There was a big example at the White House, and there's another example with the Dodgers. These were in cohorted groups. People were super careful, and they still were able to get infected. So I want to note that testing is never going to protect us entirely from transmission of this virus. Keeping our distance and wearing face coverings for now are going to be part of our lives to come, even if we're able to offer a lot of testing that happens fairly frequently. We're still going to need to wear our face coverings. We're still going to need to keep our distance, and we're still going to need to do infection control. It's just an extra tool that helps us figure out pretty quickly who are people that are positive. But for everybody who tests negative, you're only negative at the point you took that test, and you can become positive a few hours later if you had an exposure in the last 14 days. So we're going to continue to stress using masks, wearing your wearing that face covering, keeping your distance, and doing infection control as part of what our world is going to look like for months to come.
Thank you, Dr. Kerr. We just got another question just as a follow-up on testing, asking that if a staff or student tests positive for COVID, do they have to show a negative test in order to return to school?
Dr. Terashita?
The quick answer is no. So if someone is positive for COVID, they are given instructions to stay home for 10 days after symptom onset. They are given a health officer order, which will say that you must stay home for 10 days after symptom onset. And then you can go about your life as long as you're fever-free for 24 hours and all your other symptoms are resolving. Schools, we do not have any recommendations that schools require any sort of negative testing to come back.
And I want to say, if you don't have any symptoms, but you test positive, you still have to stay home for 10 days. So I know some people get confused. They're like, I tested positive, but I have no symptoms. Do I need to stay home for 10 days? That seems ridiculous. I don't have any symptoms. But you can still shed the virus even if you have no symptoms. So yes, you have to stay home for the full 10 days.
Great, thank you. And this question may go to Dr. Eduardo. If teachers are forced to quarantine due to exposure or get sick and have to take time off, are there enough credentialed teachers to fill in, or will it be an uncredentialed substitute?
So, there are substitutes that districts are using, and many of them are doing everything possible to increase their substitute so that they have more substitute teachers available to them. I don't believe that there will be teachers that are not credentialed in the classroom. What we're doing now, if we have cases, is we're sending administrators from the central office to support the districts, or we will have, more students learning through the distance learning if there's a shortage of teachers. But there would not be teachers in the classroom that are providing the instruction that are not credentialed. You can have someone that's not credentialed supervising children as they're receiving their instruction remotely, but the person providing the instruction needs to be credentialed.
Thank you, Dr. Eduardo. There's a question here about holidays. What are the guidelines for students traveling during the holidays? Upon return home, is there a quarantine requirement?
So we do recommend, but it's a recommendation, it's not a requirement, that if you're traveling out of California, when you return, you should quarantine for 14 days. I believe the Centers for Disease Control, in Atlanta, the federal public health department, is about to also issue a recommendation that says if you're traveling by plane anywhere, you should be quarantining for 14 days after you get back to your home. This is particularly true right now because, as everybody knows, it's not just LA County that's seeing lots more cases. Pretty much the entire country is seeing lots more cases. And the issue with plane travel is not necessarily that there's a huge amount of risk just on the plane, although if you're sitting next to somebody, you're going to have some risk there, particularly if they're eating or drinking and taking their face covering off. The real risk is you have to go through security, you have to sit in a waiting room, and oftentimes, there you get a lot of other exposures to people as well. So I think, our advice is yes, people should be quarantining after they're traveling, particularly if they're going out of state, particularly if you're going to a community or in a setting where there's been a lot of cases. We also say to people, you also, at this point, everyone's pretty clear on what are high exposure or high risk settings. So if you're going someplace and you're engaging in what I would call some risky behavior, you're indoors, you're gathered with 25 other people, you all came from different parts of the country, you're having this wonderful Thanksgiving meal, you're sitting crowded at a table for hours eating, there's a lot of risks there. There's a lot of risks there. So, that would be a situation where really the best advice we can give you is don't put yourself in that situation. If you end up in that situation, by all means, please quarantine when you come back for the full 14 days so that you don't create additional risk for other people around you.
Thank you, Dr. Ferrer. Another question is, what is being done to combat widening education disparities, which are getting worse because of the pandemic?
So districts are doing a lot of things. One good thing that came out of this is that now that we've been able to close the digital divide and make sure that everybody has access to a computer and to high quality internet, we're able to provide more individualized instruction. So students are getting one-on-one support. Districts are identifying which students need the additional support and are coming up with individual plans for those students to catch them up. We also had summer school providing additional support remotely to many of the students that were identified as falling behind. We know that students who were behind prior to this pandemic are going to need additional support. Oftentimes, those are students, as I mentioned before, our EL students, foster youth, adjudicated youth, children that have already had some situations that were causing them to fall behind prior to the pandemic. And districts are coming up with plans to provide additional support and instruction to those students.
And I want to also add, one of the reasons why we're really working very closely with schools is so that they can, in fact, all schools can open for on-site support and services for high need students, and that every school gets to define high need students, you know, on what they're seeing in their own school community. We don't have a definition. We don't exclude people from being, you know, students from being determined as students who would benefit from coming onto a school campus for additional services and support. And I think that's another way to make sure that we're offering services to students who may really struggle to do distance learning full time, or may need, as Dr. Eduardo said, you know, additional support. So all school buildings can be open for that. 73% of the schools that are reopened are in fact our public schools. And again, our commitment at the Department of Public Health is to actually do a site visit at every school so that parents and teachers and staff can feel that there's been a lot of adherence to the protocols that are in place to offer a lot of safety for students who really do need to come back to that building for a select set of services and support.
Thank you. There's another question here. Says, my child is involved in music. The state recently updated protocols to allow students to play their instruments and sing outdoors with social distancing. Does the county have any plans to update their protocols to allow this?
Yeah, I think we are in fact I mean, the issue for us is that we don't have a lot of students back at school yet for activities like music, but obviously we do align with the state's protocols. And I want to say, I think the exception on this were wind instruments, and the requirement is that for students who are singing that they're using their face covering still, and students who are, you know, playing other instruments. So I believe we are aligned with the state already, but we'll double check on that. And again, those are activities that need to happen outdoors. I think the question is, if your school building isn't really open yet for bringing back all your students, there may be limited opportunities for that to happen right now. I do want to say that I know that there are students who are in band, particularly the marching bands, have in fact been outdoors as part of youth sports, trying to, you know, again, do their practicing outside. But as soon as, for those schools that have waivers, TK through grade 2, those students, yes, those students can be outdoors for those activities. And for the students that are coming back for support services, if one of those services is, you know, going to be that, you know, some of your students need some music classes, they would be adhering to those protocols as well. I think it's just, we haven't really opened a lot of schools yet that are providing general education.
Thank you. And there are several questions in here as well, looking for some clarification, or just so they are completely clear about the difference between the 10-day and the 14-day quarantine periods. So Dr. Ferrer, Dr. Terashita, if you can just go over that one more time for people.
Yeah, sure. So 10 days is the minimum amount of time you have to stay isolated at home, away from all other people, if you are positive for COVID-19. So 10 days in general, that's the amount of time before you stop shedding virus. The exception to that is it's 10 days plus you need to be fever-free and have your symptoms subside if you were symptomatic. Obviously, as long as you have a fever, you may be able to continue to be infectious and shed the virus. So it really is 10 days, as long as in that 10 days you had 24 hours where you didn't have symptoms or a fever, significant symptoms or a fever. And that makes sense because that's about being sick with COVID-19. That's you're a person who's infected and you can infect others, but the infectious period for you will end after 10 days or after you don't have any more symptoms, including your fever. People who are close contacts to a case, to a person who was infected with COVID-19, need to stay quarantined, and we call it quarantined, even though it means the same thing. You have to stay away from all other people at your house. You need to quarantine, but this time it's 14 days because you are not necessarily sick at the time that we're telling you to go quarantine. You've just been exposed to somebody who does have the virus. And unfortunately for you, it could take up to 14 days for you to become infected with the virus after you had an exposure. So you got to stay home the entire 14 days because that's what we call the incubation period. That's how long it takes for this virus to actually, I don't know, I want to use the word grow, but that might not be the right analogy, but to actually grow enough in your body that we would know that you were infected. If after 14 days you haven't developed any symptoms, then you are likely not to have become infected, so you can go back after 14 days and do your regular activities. If at any point during those 14 days you develop symptoms, you need to get tested, and then if you're positive, you now will become a case and you will have to go and isolate yourself for an additional 10 days because you now could shed that virus to other people for those 10 days. But that's why it's two different time periods. In both cases, whether you're a person who's already infected or you're a person who's been exposed to somebody who was infected, quarantine and isolation means you have to stay away from other people. You cannot be, taking care of your children. You need to really stay away as much as possible from other people so you don't infect them unknowingly, while you yourself are either infected because you're positive or can become infected because you're a close contact. Dr. Terashita, do you want to add to that?
No, I think you covered that very well. 10 days is the infectious period, 14 days is the incubation period.
So she said it in like 2 minutes. Let me do like 2 sentences. So thank you, Dr. Terashita.
Thank you, Dr. Hurd. Thank you, Dr. Terashita as well. There's a question here, I have several questions about attendance. If the students have to stop attending class in person due to exposure and must quarantine, will they have the opportunity to attend school online or will they be considered absent?
No, they will have the opportunity to attend school online.
Great, thank you. There's also another question, there's several questions just about how we're ensuring that schools are following the guidelines, if there will be frequent site visits as well.
It's a great question. So, there are thousands of school buildings. Our commitment right now is that every school building gets one visit after they've reopened so that we can make sure things are working well. Schools that have any outbreaks will get additional visits. Schools where folks are reporting concerns or there are complaints will get visits. And schools where there were issues may get a revisit for us to make sure that they're resolved. But that's why we want like a parent ambassador program, parent and student ambassador program. That's why we really want to encourage everyone to feel like, you have a voice in making sure that the conditions at your school are appropriate. I mean, one of the requirements for every school is that they share with their parents and their teachers the protocols that they have to follow and what they're doing to keep their buildings as safe as possible. So you all know what the rules are at your school building. And you can, sort of be eyes and ears as well. And so can your children. But we will get to every building that's reopening, and we will always respond to any complaints or concerns. We'll do revisits to make sure that where there were concerns, they were addressed. And then, as I noted, when there are outbreaks, there's a different team that may be responding, and that may include a site visit as well.
Great, and there's another question here about symptom checks, just in general as well. Just asking if they provide a false sense of security, knowing that people can be asymptomatic as well.
Yeah, I mean, I think this is a great question, and I like to say, like, what we do is we just layer on as many protections as possible, so that no one should get a false sense of security. I don't know how many people can even remember back to February and March when all we were recommending were symptom checks because we were convinced that this virus was not going to be spread. The majority of the spread wouldn't happen through asymptomatic people. And so we relied really almost exclusively on symptom checks. I mean, we obviously told people to wash their hands and stuff, but we really said this is about making sure there are no sick people going outside of their houses. Sick people have to stay home, and we'll use symptom checks to make sure no one comes into buildings because they have symptoms. And then we learned that as many as 50% of the spread may be happening from people who are asymptomatic. And so we're going to layer on, it's still, because 50% of people probably are symptomatic, we still want to check for symptoms. We still don't want sick people in our buildings. But knowing that a lot of people may be able to spread and they're asymptomatic, we're going to require all these other measures: the mask wearing, the cleaning, the frequent hand washing, the distancing. That's all so that nobody has a false sense of security. So that symptoms, checking for symptoms and keeping people out and home and away from others who are sick, that's a good protection, because probably 50% of the spread is happening from people who are symptoms, but everything else still has to be done because there's a lot of people who can still spread even if they have no symptoms.
Thank you. And there's another question here. What is contact tracing and how do you become a contact tracer?
So, contact tracing is what we do, and it's a little bit of I think it's a little bit of a misnomer. Contact tracing for us really involves interviewing a case, so that's a person who's positive, and finding out who all their close contacts are, and then interviewing all their close contacts as well to really make sure they understand that they have to quarantine and to help them quarantine, but also to find out where they may have been as well, in case there are any high-risk settings that we have to worry about. But it involves interviewing people, and the main way we interview people is over the phone. And so obviously, we really rely a lot on people cooperating with us. At the schools, there's this added layer because the school community is going to help the public health department do that contact tracing. They're going to know all of the exposures that may have happened once a case gets identified, and they're going to help us figure out who the close contacts are. But our team will still make those calls and talk to people. I want everyone to understand we also issue what we call health officer orders, and these are legally binding documents that let people know if you're a case, you have to isolate, and if you're a close contact, you're required by law to quarantine. So part of our contact tracing system is to allow us to issue these orders so people are really clear. A big part of it is to make sure we're helping people be able to do both successfully. If you're going to have to stay home, for some of us that may seem pretty easy. We have our own bedroom, we have our own bathroom, no big deal. We have other people who can help take care of our children. For the vast majority of us, this is extraordinarily complicated. So our contact tracers are also there to help people. If you need resources, if you need to get connected to some help to get food into your house, if you need help, getting yourself connected to a healthcare provider, if you need help figuring out how to care for your children. Contact tracers, we can't solve everything as a contact tracer, but we try to help with all of the sort of practical issues that come with needing to isolate and quarantine. So we want people to talk to the contact tracers because they're really, really good at their jobs, and they also are going to be as helpful as possible to people who may have a lot of questions, a lot of concerns, and for some people who need to get connected to other support. Right now, we have about, I want to say, almost 2,500 people that are contact tracers. You do have to work for us or be under contract with us to be a contact tracer. There are some organizations that have a contract with us, so it's like a memorandum of agreement so that their staff are assigned to us to be contact tracers, but we don't really have an easy way for people to just come to us right now if they want to be a contact tracer, because we have 2,500 people who are doing this right now. And they're all well trained to do their job. There are opportunities that will be happening over the next few months with our community organizations for jobs that will be happening in the community to help our contact tracers. So as I noted, sometimes people need help with food, they need help getting connected to a doctor, getting their health insurance. So we're going to use a lot of our community organization partners to help with that, and there will be some jobs there as well. There are also some jobs right now. Community-based organizations are hiring community health workers, again, to help us with outreach and education. But the contact tracers, we already have 2,500, and it's unlikely that we're going to need more. These are often, we have about 1,000 workers from the state, we have a few hundred from the city, and the remaining are people who work in the county family who have been trained already to do this job.
Thank you, Dr. Farrar. Yeah, just about 5 minutes remaining. I want to try to get through one or two more questions. Question here about transportation. Are buses going to be available for students who don't have transportation to their school setting?
Buses are available. I want to say buses can be available. So I'll talk from the public health side of the house. We have restrictions on the number of students that can be on the buses, but absolutely children will need transportation. We require that only one student be in each seat. Wherever possible, if windows can be open, they should be open, and everyone has to have a face covering on. I think there are a lot of issues for the school districts, and Dr. Eduardo can talk about how they're working out transportation, but there's no restriction that says children, if they can't get themselves to school by their parents, or themselves, then they can't go. Transportation options are allowed, just with the restriction I mentioned.
Yeah, and districts are transporting students, for many different reasons. Students with disabilities, students in specialized programs are being transported when school is in session. And for those who have already started to return, will be using transportation. I can't say that transportation will be widely available for any student that needs transportation that didn't qualify it for it in the past, simply because school districts don't have the funding to transport every student that doesn't have transportation. But each district will be working out those issues. As you know, we have 80 districts in LA County, and each district is taking a very close look at the needs of their students in their communities.
Thank you. And, I know we're running out of time, but I think this last question might be important for parents. They're asking if we can discuss the risk of contracting the virus from a surface versus the droplets directly for someone. This person is wondering if there's a high risk of their child obtaining the virus from touching a surface versus being in close contact.
Dr. Teresita?
Sure. Yeah, that's a very good question. A very common question we're getting. This virus, COVID-19, is predominantly what we call respiratory droplet spread. So usually it's when one infected human coughs or sneezes and infects another human. That's the predominant mode of spread. But the question is very important. We do have what we call surface spread or fomite spread, sometimes we say, where a person who's infected could cough into their hand and then touch a doorknob, for example. Someone else coming by could use that doorknob, right? And then touch one of their mucous membranes and get infected through that route. It is very possible that that's a route, and it's one of the reasons why we are stressing environmental cleaning and using a disinfectant that works against COVID-19, but it is not the predominant way. So again, we think the best things to do are socially distance from other people, stay 6 feet away, keep your face coverings on, and that'll protect you the most.
And obviously, if everyone is keeping their face coverings on, there's very few respiratory droplets that are getting out when you're coughing or sneezing or yelling or whatever you're doing, because you have your face covering on, and that will keep you not only from sending it directly to a person that's close to you, but also from your respiratory droplets falling on a table that then gets touched by somebody. So these face coverings are an essential piece of trying to reduce risk in a school setting.
Thank you so much. We only have a minute or two left. I want to thank everybody who sent in questions. If we didn't get to your question, we're going to be posting some of the questions we didn't get a chance to answer on our website. So please stay tuned for those answers. We will be posting them and pushing them out on our social media channels as well too. I want to offer our speakers an opportunity just to offer a minute or two of just some quick closing remarks. Dr. Eduardo, if you want to go ahead and go first.
Thank you. Again, I want to thank everyone for joining, and I want you to know that school districts are doing everything possible to bring students back in a way that is going to be safe for students and employees. We are following all of the health orders and guidance in terms of making sure that we have a plan for social distancing, for hand washing, for how children are eating. I mean, all the precautions that are in there, we are making sure that we are following them. We are visiting sites to make sure that's happening. At the same time, we are improving our distance learning, making sure that all families have access to the computers and the Wi-Fi that they need, that parents will have options, and sometimes we'll have to go in and out, and we need to have a smooth transition. So if somebody is symptomatic and they can no longer physically come to school, they can easily transition to distance learning, and so that there isn't any disruption in their child's education. And I just want to say that I know everybody is working really hard to make this happen. Our teachers, our administrators, everyone wants to see children back in school. We just want to make sure that they are safe and that we're doing everything possible to educate everyone. As was mentioned before, you know, we need everybody to follow the directives. And if everybody is doing that, that will certainly allow us to bring students back to school faster. So thank you.
Thank you, Dr. Eduardo. Dr. Terashita?
Thanks, Brett. I'd just like to say that we're relying on all of you, the parents out there, the staff at schools, to do your part. This is a novel virus in a naive population, so we know people are getting sick. We know people are getting very sick, and we want to keep everyone safe. We share your goals of bringing our kids back to school and keeping them safe, keeping staff safe, and we thank each of you. Everyone who's on this call is very involved, and we appreciate what you're doing. Thank you.
Thank you, Dr. Terashita and Dr. Ferrer.
Yeah, no, thank you so much. At first I really want to thank Dr. Eduardo and her entire team at the LA County Office of Education. We have these unique opportunities that come across our lives, at different times, and this is one of those opportunities. I mean, there's a lot of devastation that's occurred because of COVID-19, but there's also been some very rich partnerships that have developed, and I think the ability to work with the LA County Office of Education and Dr. Eduardo and her team to really come together so that we can be of service to all of you, to your families, to your children, and with the shared goal of, again, making sure that during this difficult time of a pandemic, we're able to actually do everything we can together to offer high quality education for every student. And whether or not for some of you in the months to come, that's going to be a continuation of distance learning. I want to applaud all our educators for doing their very best to offer high quality learning opportunities, or whether that's for another group of parents and students, the opportunity to get back into the classroom because we're creating environments that are as safe as possible. All of it really requires every single one of us, as I think we've all said, to do our part. We spread more virus when there is more virus to spread. So if in fact we take care of each other, we protect each other, we have lower rates of transmission, it makes things a lot safer at school, in our community, and at your homes. So we're in this for months to come, but I know that this is a community that can come together. We can all do our part. We can reduce transmission, and we can take care of all of the young people who are relying on us to make sure they have the services and support they need to thrive. So with that, thank you and good night.